This is all to cope with what doctors are calling a real crisis in mental health across the state of Indiana.
So this morning, state leaders announced a new emergency number dedicated to people suffering from a mental health emergency.
Dustin Grove tonight with the system set up to save lives.
911, where's their emergency?
In an emergency, cries for help go to 911. But when it comes to a mental health emergency, a new number is answering the call.
Thank you all for joining us today.
State leaders announced the launch of 988, a rollout that's been in the works for more than a year to address what health experts call a mental health crisis in Indiana and across the country. Anxiety, depression, and suicide on the rise, but not enough access to help. Getting an appointment for a counselor or psychiatrist can take weeks. In a crisis, dialing 988 will get a trained crisis counselor on the other end of the phone.
So we're very excited about where we are at this starting point.
The state also announced a new partnership with Riley Children's Health, an $8 million investment to put mental health professionals directly into your local doctor's office.
This program allows us to bring the right expertise to the primary care physician's office so that they don't have to go somewhere separate, and to provide access in a much more timely manner.
It could mean relief for families like this one.
There's such a shortage.
Earlier this year, this mother told us getting help for her teenage son had been hard to find.
When I call, they say that they're not taking any new. They're dealing with trying to get people off the wait list, but they can't tell me like a timeline.
But now, more help at the doctor's office and an emergency hotline. Advocates call them critical lifelines, saving precious time to save precious lives.
So coming up at 6, we're going to have a breakdown of that state and federal money and where else it's going to help expand mental health help here in Indiana.